Coming up today, when one woman started seeing doubles, doctors blamed her pregnancy. A second opinion found the real answer and likely saved her life. Good morning. It is Monday, March 27th. I'm Jessica Lovell, and welcome to the Morning Medical Update. Today, meet a mom who saw doctor after doctor as she tried to figure out why she suddenly had double vision. Some doctors chalked it up to her pregnancy, but experts here at the University of Kansas Health System found this, a life-threatening tumor pushing on her optic nerve. Joining us here in the studio is Amanda McCrae, alongside two doctors here at the health system who were alongside her for the journey. Dr. Matt Twardowski is an optometrist who helped figure out what was really going on, what was really wrong, and Rukos Shamoun, he is a neurosurgeon who removed that tumor. So thank you all for being here with us today. Good to see you. Excited to learn more. Amanda, when these vision problems started, you were pregnant with your second child, right?
Yes.
When did you decide to tell your doctor that you were seeing double, that maybe this was something more than just some weird effect of being pregnant? You know, our bodies do all sorts of weird things when we're pregnant.
Yeah, so I first told my OBGYN, and a lot of things can happen to your body during pregnancy, and so it felt natural to me and like a good explanation that this would be just my pregnancy, maybe high blood pressure, or who knows.
And what did they say?
They agree. They, doctor after doctor, nurse practitioners, even eye doctors told me that after you have your baby, your hormones will go back to normal. Excuse me. They'll go back to normal and you'll regain your vision or your normal vision.
It seems so drastic, you know,
Yeah.
like you'll regain your vision after you have your baby. How bad was the double vision? Talk us through that.
So at about 6.5 months pregnant, I could kind of tell that things were getting, it wasn't fuzzy, it was truly double vision. I was seeing two of everything. Oh. And that just progressively got worse to the point where I wasn't able to drive. My saint of a husband and father-in-law were taking me to school or to work. I work at a school at very early hours and picking me up every day. And I wasn't able to read or watch TV. And then I would say up to a couple of days before I delivered my son, I wasn't even able to like carry out normal tasks. Like walking became kind of hard. My depth of perception was off. I got dizzy.
So this is 3 months, if I'm doing my math correctly. You said this started at 6 months?
Yeah, it was
a little before.
Yeah, well, I would say from beginning of February to end of March was when it was really bad.
And I'll have to say, you're a principal at a high school, so
yeah,
you being able to see and being on top of things is
yes.
slightly important. You gave birth to Max 1 year ago, yesterday in fact, so happy birthday to Max. But
yes.
The vision problems continued, and eventually you saw Dr. Twardowski at the KU Eye Center. So tell us about when you first hooked up with this guy.
Yeah, so I had been to, at that point, 5 doctors, and that goes from OB to optometrist to even ophthalmologist, and all of them had said, even pre-baby and post-delivery, postpartum, they had said your hormones will go back to normal, give it up to 8 weeks. And that just felt very hard because, you know, this was 3 days after having a baby and I wasn't even able to see my son. And that was really challenging.
Yeah, you don't
really
have to explain that because that would be that's like the one thing I can't wait to see him.
Yeah. So then a friend of mine actually, I'm sorry, a friend of mine actually said, I really want you to get a second opinion. She works at KUI. She said, I really want you to get another opinion. Can you please just try to go to KUI? And I got an appointment with Dr. Twardowski, and yeah, he can explain the rest.
So what was it like when you first met Amanda? She walks in, and now it's up to you to figure this out.
Yes. First, the emotion, the raw emotion of it. You have this mom that just had a baby a couple days ago. She was sleep deprived, and certainly we all know what that is like. But she walked in, and you could just tell that there was a real emotion and a real concern and a real fear And it just came across, it was palpable in the room. And so at that point, you just start looking and you're like, something's going on here. We gotta figure out what that is.
And is it often that somebody comes into you and it's more than just an eye issue? I mean, how common is it for you to then find out through testing that it's a tumor? And when did you find that out with her?
Yeah, so I mean, that's obviously one of those questions, you know, how do you find a brain tumor when you're looking at the eyes? But it's not as uncommon as you think. She's not my first patient, unfortunately. But at the same time, in Amanda's case, it was really about the double vision. So she's a younger, healthy patient, comes in with this new onset double vision, which we call diplopia. And the first thing we had to figure out was, is this true diplopia? Is this true double vision? And in her case, it was pretty obvious it was. She couldn't move her eyes to the right, and her eyes were vertically imbalanced a little bit. And we have certain patterns we're looking for, and hers just really didn't match the patterns. And at that point, I knew that we would have to get some neuroimaging done. And right down the hallway from me, we happen to have a neuro-ophthalmologist, Dr. Tom Whitaker, who Amanda knows as well. And so I knew she was going to need some neuroimaging. And at that point, I said, hey, Tom, take a look and tell me what you think on this as well.
Then, yes, go ahead,
I was just going to say, I would also say Dr. Twardowski was the only eye doctor who I saw who didn't run the traditional 1 or 2, which, you know, the eye test. He ran other tests, and that felt even comforting for me, sitting in that chair. Like, okay, we're doing something different.
It's nice to know, not only is he doing something, but he's also walking down the hall and bothering to, you know, get all these brilliant minds together to try to figure out what's going on with you. So that's such a big deal. And that's when we bring in Dr. Shamoon. How did you, tell us about that tumor. How did you determine that this was something that needed to be removed? And we're seeing some images here as well.
Yeah, right. So, I mean, the first part of the challenge was diagnosis, as you heard. I mean, discovering the brain tumor was challenging by itself. But then now that we know the tumor is there, treating this is a completely different challenge. So there are 2 aspects of this tumor, is the location and the size. In terms of location, this is a skull-based tumor. It's deep in the head, very critical location. It's an area called the anterior clinoid process, surrounded by very important critical structures, important nerves, the nerve of the vision, optic nerve, you see with that nerve, the other small nerves, they control eye movements and eye coordination, and a lot of important blood vessels and arteries. So the location was very critical. And then you have the size. We're talking 5-6 centimeter tumor.
If we could pull that back up again just to see what you're talking about, because it looks large.
Yeah,
and if that's pushing up against anything, I can imagine that causing problems.
Right. And you see, I mean, this picture probably shows the tumor alone, and then other pictures can show you the swelling of the brain around it. And you combine the size of the tumor, the swelling, and see the whole brain is shifted to one side. So
when you saw that, did you know immediately that what was causing the double vision?
Yes, absolutely.
So thankfully this was not cancer, but any tumor in the head is dangerous. And I'm sure when you saw that image, you're thinking, that is inside my head. What was that like when you saw these images?
Oh, it's hard to describe because it was in some ways, I mean, it was 100% frightening and just terrifying to see, but at the same time, and I think this is a true testament to the doctors who were surrounding me, it also felt comforting to know I'm not losing my mind here. I'm not crazy. This is not just my pregnancy. There is something else. And I mean, as scary as it was, I felt all the confidence behind Dr. Shamoon and his team. And that was something that I hadn't felt in a couple of months.
Just that relief alone.
Yeah.
Then, Dr. Shamoon, you determine you can remove this. What goes into that strategy?
Yeah, so a lot of factors. A tumor of this size, this location, I mean, this cannot be treated in any small hospital, in a community hospital. You need to be in a large medical center like this one. It needs a lot of experience, expertise. You need the right setting, right techniques in the operating room. You need the right care in the ICU. So a lot of factors there. And we do this on a regular basis. I mean, this is obviously not a unique case for us. It's a unique case for Amanda, obviously, but but for us, not a unique case. We do these on a regular basis. And this is where you want to be. You want to be in a place where they do this over and over again. This is what we do on a regular basis. This is where you want to be.
Yeah, it's a day at the office for these guys, Amanda. So
and that's kind of how I remember sitting in your office. I mean, I had a 2-week-old at home, and Dr. Shamoun, I asked him, you know, and my husband was asking him, how safe is this? Like, how certain are you that you can do this successfully? And Dr. Shamoun very matter-of-factly said, well, this is what I do every day. Like, this is just as he explained it right now. And again, that just, it was like, oh, okay, I can breathe a little bit of a sigh of relief. I have this huge tumor in my brain, but we have a way forward.
And it's what these doctors do. It's what these two sitting here was all about, you being able to see Max properly for the first time. And we have a photo of you and Max from the day before the surgery. You were still, of course, seeing double vision at this time. Do you remember this photo when you were taking it?
Yeah, I do. There were so many emotions. This was actually a gift from a few of my girlfriends. They got together, and knowing how emotional I was at this point, they gifted me some portraits, some pre-surgery and post-baby portraits.
One of those things you would never know, okay, that hidden tumor and that eyesight that you would never know. Beautiful photos. The next day, Dr. Shamoun removed the tumor, and just after the surgery, your husband Andrew was recording audio when Dr. Shamoun came to talk to him after. Let's listen in.
Surgery went very well. I'm very, very happy with it.
Awesome.
Tumor is out. The brain looks good. Everything is fine. So I'm not really expecting problems.
Great.
You know, we'll have to wait for her to wake up, see how she's doing. But everything's pretty much as planned.
Okay, and were you able to get the whole tumor out? Did you?
Yeah, everything's out.
Oh, wow.
Everything's out.
That's great news. Thank you. That's
Okay.
incredible.
It's what every spouse or loved one wants to hear when they see the doctor, and to know that, you know, when you first met Amanda, and then here she is after you get her referred over to Dr. Shamoun. What's that like for you, just to see this all kind of come together?
Couldn't be happier for her. Certainly, as I said, I have young kids as well, much like she does, and being able to go home and hold your baby and see your baby clearly, it's a pretty cool feeling.
Simple joy that you take advantage, take for granted when it's not able to happen. And Amanda, you said that you go back and often listen to that recording. What does that do for you?
I mean, I think that it's just it's an opportunity to take a step back and express gratitude, be grateful, not take anything for granted. And I really, from the day that I saw Dr. Twardowski to Dr. Whitaker to even Dr. Shamoun, everything at KU has felt like I was the most important patient who they had that day. And as Dr. Twardowski said, like, I could tell that he really cared about me and about Max, about my family, and that meant something to me.
And Dr. Shamoun, any challenges for that surgery? It sounded pretty routine when you came out and talked to Andrew, but anything that while you were in there, that you came across?
Yeah, I mean, so these tumors are always very, very challenging. Skull-based tumors are very challenging, and we are very proud and happy here at KU to have a comprehensive skull-based program. So we have very advanced skull-based team. You see in Amanda's case, the surgery was done by one surgeon, just neurosurgery, but it's a teamwork between ophthalmology and neurosurgery. In a lot of cases, is much more than that. It's a multidisciplinary approach. We have ENT, radiation oncology, ophthalmology, neurosurgery, all of these people involved at the same time. So we have that infrastructure here. We have the skull-based program. We meet on regular basis. We discuss cases and we treat patients that are this challenging and complex.
And Amanda, you shared some photos showing the staples in your head post-surgery. What were those first few days like after the surgery?
It's hard to describe. Again, the most dramatic thing that happened the second I woke up from surgery, I opened my eyes and I was able to see. 20/20 vision, it was really wild. And then there was some pain, but quite honestly, it was a pretty easy recovery. a remarkably easy recovery.
And you had that newborn waiting for you on the other side
I
of that.
did. I did. That made it a little sweeter.
Yeah, a lot sweeter. And we have a photo of you and Max after the surgery. What was it like to finally see him? I mean, just to see anything, but then to see that little guy.
Oh, it was pretty awesome.
Pretty awesome. Okay, so tell me about this. You shared also a photo of you and Andrew, your husband, a little chart that you have. It's hard to see, so just tell us what's on that chart and why you guys holding it up.
Yeah, so this picture, my husband is much more type A than I am, and so he was also very concerned with, just my recovery, and so he worked with the post-op team, and every time we would call with even the simplest questions, it felt like we were just calling a neighbor or someone. They were very responsive, and he worked with them to make a chart of all of the medicines that I was supposed to take and for how long. Some of them had decreasing dosages, and so he had mapped that all out and was taking care of me in that way.
And he even wanted to take a picture of it. So
yes.
He wants to document the documentation.
Correct.
He wasn't going to mess up one bit. How quickly did you start getting back out there again and just completely feeling normal?
Well, I would say my trips to Costco weren't that quick.
It's hard to stay away from Costco.
Yeah,
let's just be honest.
But no, I was able to get back, and walking was the day of surgery. In fact, I remember asking Dr. Shamoon, when will I start eating again, and when will I? And he said, oh well, you'll have dinner, you'll have lunch that day, So it was a shockingly quick recovery. My first son, Bruce, he turned 3 just a couple weeks after my surgery, and we were able to get out and celebrate his 3rd birthday at the zoo and walk around. So yeah, I was taking things slow, of course, and I did get fatigued a little faster, but I do think that just kind of staying as active as I could and moving around, excuse me, did help.
As we share some of these family photos, tell us, how did Andrew handle this journey? It's a lot to have a pregnant wife, a toddler at home, one on the way, and then a wife who's about ready to undergo surgery for a tumor.
Yeah, he was a champ. I know that looking back, that's all I can think, but I do remember the day that Dr. Whitaker called and said he had reviewed the MRI, and he said, this is a pretty large brain tumor. And I remember both of us were standing in the kitchen, and I just crumpled to the floor, and we were both just crying. And I don't know exactly what was going through his mind at that moment, but I remember we had a sleeping 4-day-old in the other room, a toddler, and we're getting this news. I'm sure that it rocked his world as much as it did mine, but like I said, he was a champ through all of it.
A champ. So Dr. Shamoon, is the hope here that people should feel is that, when she got that phone call that this was a tumor, that would rock anyone's world to hear it. But again, I go back to this is what you do. This is what you're so specialized in. Is it fair to say that, not to be so relaxed about it, but it isn't truly the end of the world, that these can be cared for, they can be removed, you can do your work, and people can have success stories?
Right, yeah. In the clinic, we see a lot of patients completely devastated by the diagnosis of a brain tumor. Just show up to the clinic and they have no idea what to expect. The reality is that a lot of them are benign, are treatable, are curable. Sometimes maybe not curable, but you can manage them. Few of them are unfortunately bad cancer type, but we always have options for the patient. So yes, especially if you are told that there is no option for you, no surgery, no treatment for you, come get a second opinion.
Come find you, right?
Well, KU.
Come to KU. Okay, so I want to show a picture of Dr. Whitaker. We've mentioned him several times today. This was you all this past September, and I remember. Well, first of all, what was it like seeing him? And then I'll tell you my little story about him and you and Dr. Twardowski.
Well, I'm sure that Dr. Twardowski can. I'm a very emotional person. I wear my emotions very clearly. So just walking into the clinic and seeing Dr. Whitaker standing there, I just immediately broke down in tears. Because truly, I think, I mean, the work that he did and the work that Dr. Twardowski did to help me find my way to Dr. Shamoon is, I mean, it saved my life.
So, Dr. Twardowski, so I had asked Dr. Whitaker to be on, but he gave you all the credit. He goes, oh, no, you got to get that guy on. And I said, so, no, he goes, no, I want to step aside and let you take all the credit for this. I don't mean to embarrass you, but how does that make you feel to know that he gave all the credit to you? And then I heard that you were really hard to get on this program. So then I said, Dr. Whitaker, you got to be my backup. If Dr. Twardowski is super busy, then you got to be here. But so I was so happy you could come on, and I know you were really excited to see Amanda. But yeah, you were kind of the guy.
Thank you. I was humbled by that. But yes, I'm not one for the limelight, so I like to just go about my work and help people and then go home to my family.
Well, and we appreciate that. But to know that you come in and you're kind of that first line of defense. I mean, you meet her first, and then it's like you start that journey down the road to where she's now back at home, seeing her baby. So that's gotta be rewarding.
That's why you do all the training and why you show up.
Okay, I'll stop embarrassing you now.
Thank you.
But truly, there's a reason why my visit with you looked very different than the 3 other eye doctors that I had been to.
Yeah.
Thank you.
Power of the second opinion.
Very
so
true.
if you have any questions for Amanda or our doctors, please send those into YouTube, Facebook, and Twitter. Also on the Medical News Network. You can find links to those right there on your screen. Let's get a quick check of our COVID count from Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. A happy Monday. How are you?
Yeah, it's a good Monday.
It is.
And good for cases here at the hospital, too. So right now we have seen a decrease in our total cases, 38 total cases. Only 22 active and 3 in the ICU and none on the ventilator. So that is a good thing.
So, Hawk, new research shows the risk of long COVID goes way down for both people who are vaccinated and people who took Paxlovid while they had COVID.
Yeah.
Then a study published in JAMA, Internal Medicine, showed that Paxlovid cut long COVID risk by 26%. Your thoughts?
Yeah, no, I think this is good. We know that long COVID does affect so many people, even after mild disease, in different ways, whether it's neurologic or the POTS syndrome that we've seen or the fatigue. So it is a significant issue and will continue to be a significant issue that people have to deal with on a daily basis. We know that the bulk of the data support the fact that the vaccination helps reduce your risk of long COVID. And now we have evidence of one of our active antiviral treatments, Paxlovid, can help reduce the risk as well. This was a study looking at the Veterans Administration data, and showed that there was a reduction in the risk of long COVID. And so I think it's just one more thing to show that the vaccines and these drugs that we have can help reduce your risk of long COVID. So it is it's a very good thing to show that because we know how many people deal with it. So, but the important thing is getting tested early and getting on Paxlovid early in that course, especially within the first 5 days if you can.
COVID's still making those headlines. Had to ask. Dr. Hawkinson, thank you. Any reporters with us today? Well, let's get to some community questions. And Georgianne, one of our faithful viewers, just said, what an adorable family. She said that must have been terrifying for you, but she's just so glad that, Amanda, you are doing well. Tess wants to know, how did Amanda's family care for a baby, a toddler, brain surgery patient all at once? I asked you about that with Andrew. You said your father-in-law was helping. I bet that was a big old team effort.
Yes, it really was. It was, so my mother, my stepmom, they both came, my sister, they came from Arizona actually, and they helped. My mother, or my stepmom, stayed 3 weeks and was away from her family to be with us and to help me take care of Max. But beyond that, I mean, we had neighbors who were mowing our lawn and just bringing food, bringing by things, offering to take Bruce, my toddler, my 3-year-old, down the road or down the street to their house to play for a little bit. It was truly like just a wraparound.
It's the village
family.
that they talk about.
Yes,
It
it was
takes
the
the village,
village.
yeah.
Absolutely.
I love his name is Bruce, by the way. How adorable is that? Dr. Twardowski, Jerry wants to know, how does someone know to come see you, needing a higher level of care? How do they know to find you?
Well, sometimes in Amanda's case, you're not, you know there's something going on and you're not getting the answer that you're wanting, right? And so, but having said that, we also do comprehensive eye exams. So, I mean, I see patients of all ages and all problems, and fortunately, most of my patients do not have what Amanda had. I'm thankful for that. I know Dr. Shamoon deals with those things all day. But no, I mean, we run the gamut in terms of what we see. But certainly, if your gut's telling you something and you don't feel like you're finding that answer, we're happy to take a peek.
Yeah, you must love that she just didn't take literally no for an answer, and she knew her body,
Very
and she
true.
knew to keep asking. You said doctor after doctor after doctor, and then you found another doctor, so
Yes.
we really like that. Riley wants to know, could you feel the tumor at all? Was there any feeling that you could feel inside?
No, I didn't feel it. I didn't, you know, a lot of people ask, you know, did you have headaches? Like, you had to have had headaches or something. But no, truly, all that it was, and if I did have headaches, that is something that I had throughout pregnancy. But it was the double vision.
Yeah.
I mean, sometimes when I would lay in bed at night, I would lean to one side, and the double vision would improve a little bit, and that was kind of weird.
So was
But-
it relieving the pain or releasing off of that pressure, Dr. Shamoon? Is that just happened to be because she turned over?
Yeah, it just happened.
So what is that mass? What is it like inside her head? I mean, we saw those photos and it looks so large, but when you take that out, just tell us, what's it like? What's that mass like? Is it solid, hard?
It's a tissue. They come in different shapes and forms. Tumors, some of them are very soft, some of them are very rubbery and hard. This one specifically was a little bit intermediate, so not too hard, not too soft, which is very common for these tumors.
I do remember, and going back to the recording, you asked, why do you go back and listen to it? When we first met with Dr. Shamoon, he said to us, the texture and, the makeup of the tumor is going to determine whether or not, how rigid it is, I think was the word that you had used, is going to determine if I can get it all or have to leave some behind and then do follow-up radiation or what have you. And so that was the significance of the question that Andrew asked, were you able to get the whole tumor? And his reaction of, that's incredible, when Dr. Shamoon said yes.
One last question. Leslie wants to know, is there a difference between skull-based tumor and a brain tumor? We hear that a lot, but I think we lump it all into just a tumor is a tumor. What's the difference?
So brain tumor is a more generic term. It can be a tumor anywhere in the head. Skull-based tumor is more specific for a location. It's at the base of the skull. These are typically more difficult, more challenging cases. They are more dangerous to remove, surrounded by very important structures. So, and this is when you need a bigger team to deal with this, people with more experience, expertise. And this is, fortunately what we have here at KU, a very advanced skull-based program.
Let's get today's takeaway. Dr. Shamoon, I'll start with you. What do you want folks to know?
Well, the power of the second opinion. This is what you said, and I see this on a regular basis in my clinic. Patients are told there is nothing can be done for them, or maybe just go for radiation straight, surgery too dangerous, surgery cannot be done. So if you're getting an opinion like this, just come to KU.
Amanda, your final thoughts today.
I would say just trust your body. I think, unfortunately, in healthcare, women, and especially pregnant women, are just overlooked or, like you said, chalked up to this is pregnancy. But trust your body and get the second opinion.
Dr. Twardowski, final thoughts. And now that you came on, now you're gonna have to come back. You know that.
We'll see.
Okay.
I'm echoing those thoughts as well, which is trust your gut from Amanda's perspective. She felt like something was wrong, and certainly just you have to keep going until you find the answer you're looking for. And then from the eye world, we find a lot more than just the need for glasses when people come in. So
Glad you all are here. Thank you so much for sharing your story too, Amanda. Appreciate it. Dr. Hawkinson, your final takeaway today.
Yeah, my takeaways. Again, just a great story of different physicians, different medical teams, and different specialties working together to help you, the patient, and you and your loved ones get back to having a good quality of life. So I think that's great, just another great story. The other thing is, just like you said, Jessica, COVID is still out there. We have the tools, you have the tools and the knowledge to help reduce your risk of those severe outcomes. It's staying up to date with vaccines. It's getting tested early, getting on Paxlovid early. All those things will help reduce your risk of hospitalization and severe disease, but also, more importantly, in your day-to-day life, help reduce your risk of long COVID as well.
Thank you to all of our guests today, and thank you to our viewers, as always, for being here. We will see you back here tomorrow. Coming up tomorrow on the Morning Medical Update, radioactive seeds planted inside the body. I'm Jessica Lovell on the next Morning Medical Update. We explore the advanced treatment that attacks cancer with precision, allowing higher doses of radiation with fewer risks. Tuesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.